evening, ladies and gentlemen. As we are about to begin, we ask for your cooperation this evening and wish you a enjoyable session. Please ensure that you are signed in with your full name, first and last, for record purposes. Lastly, we would like to inform you that this event is being recorded for storage and archives. Therefore, to ensure the integrity of our production, we kindly ask for your audio and video functions to be turned off. Thank you once again for joining us this afternoon and for your cooperation. It is now with great pleasure that I hand you over to our President, Rondell.
Good evening, ladies and gentlemen, and a special warm welcome to our specially invited guests and colleagues from the Mona and Cable campuses, as well as the University of Ottawa, who is our partner for this event. I am Ranjiva Brijlal, as was mentioned, and I am the President of the Pathology Club of UE. And I'd like to thank you for joining us for a mentorship session featuring two very inspirational and indeed brilliant medical professionals. The opportunity to be joined by experts who occupy all levels of the spectrum in a journey we aspire to take part in is most privileged, and in advance, we would like to thank our speakers, Dr. Rondell Graham and Dr. Solange Denoon. Your generosity and investment in us, the future of this profession, has, is, and will not go in vain. In a study I recently co-investigated, where we sampled the current medical students of the University of the West Indies, St. Augustine, 72% expressed an intent to migrate, and the specialties of cardiothoracic surgery, general pediatrics, and general surgery grasped the top 3 desired specialties. More than having a US-based associate professor of pathology and a UK-based pathology research fellow, both from the Caribbean, we have persons who have either been through or currently going through a specialization process in the 2 main areas that persons from the Caribbean area migrate to after the MB.BS, that is to the United States and the United Kingdom. The process of getting into and being part of, at least from afar, is very different from the process of matriculating into our local and regional DM programs, and has even been described as long, complicated, tedious, especially to us international medical graduates. We have therefore endeavored to hold this mentorship event with the gracious support of our 2 speakers who volunteered their time and expertise to address the uncertainties which we may have on the process and provide answers. Perhaps of most interest, they will cover the very important topics of entry examinations, requirements for and the process of specialization, inclusive of research, residency and fellowship life, and transition as Caribbean medical students. I now wish to pass you over to Natalia, our secretary, who will be introducing Dr. Solange Denoon.
At this time, ladies and gentlemen, I am privileged to be introducing our speaker this evening, Dr. Solange Denoon. Dr. Denoon graduated with a medical degree from the St. George's University, Grenada, magna cum laude, after which she worked as a senior house officer in the pathology department of the San Fernando General Hospital for 2 years before migrating to the United Kingdom. In 2017, she entered the UK Histopathology specialty training program, during which she undertook a 6-month fellowship in soft tissue and bone pathology. Dr. Denoon then entered into the clinical academic route with the CR UK-funded research project at the UCL Cancer Institute in London. She is currently a clinical research fellow and a PhD candidate in the Flanagan lab at the UCL Cancer Institute, studying the genomics of osteosarcoma. Her additional roles include a trainee subcommittee member of the Pathological Society of Great Britain and Ireland. Without a doubt, Dr. Denoon stands humbly and proud as a visionary in the field of pathology. We are all honored, pleasured, and privileged for her to be with us this evening. So, ladies and gentlemen, I ask you to now welcome Dr. Solange Denoon.
Hi, good evening, everyone. Thank you, Natalia, for that very generous introduction. And I'd like to thank the President, Vice President, and the other committee members of the Pathology Club for inviting me to speak today. I'm going to begin by showing some slides, and I hope everyone is able to visualize my presentation. Please just stop and shout if you aren't able to see. Can I ask Natalia or someone else to confirm that they can see my slides?
Yes, Dr. Noon, we can see your slide and hear.
All right, that's great. Okay, so I'm going to begin by talking about the UK route to specialization, or as most of my relatives put it when I made this choice, going to study in the cold. And so I'm going to talk a bit and rather briefly about my path, as I think it's been covered a lot in the introduction. But just to say that I did my medical degree in SGU in Grenada, and then of course I came back home. I did my internship at Mount Hope, and then I spent 2.5 years working at a pathology house officer in South. It was during this time that I made the decision that I wanted to specialize in pathology and that the UK would be my best bet to do that. And my personal reason for this was because I had spent 2 years of clinical rotations as part of my SGU training in the UK. And I felt that their system is quite familiar to how we practice in Trinidad, and thought that that would be a good fit in terms of specialization. And so the first step to that was I actually took a locum job, and I applied and I got a 1-year job in a London hospital, St. George's University. And during that time, I spent it preparing to enter and essentially apply for the histopathology training program. And so 1 year later, I was successful and I got a placement in London in the histopathology training program, which is essentially run through the Health Education England of NHS and is following the curriculum set by the Royal College of Pathologists. This program is a 5-year run-through program, meaning that you just go through the 5 years, you do the exams at the designated times, and you can come out magically a consultant. I did a slightly different route, and that's because I developed an interest in research, being in the environment. And so quite fortunately, because of my time spent doing pathology in Trinidad, I had enough experience to be able to take on a specialization quite early on. So in my second year, I ended up spending 6 months at a tertiary specialist center, which is the Royal National Orthopaedic Hospital. And so I spent the first 6 months learning the pathology of soft tissue and bone tumors, and then the next 6 months doing research on these very same cancers. And so from that, I was able to be successful in getting funding for a PhD. And so I'm currently on my PhD time at the moment. This is a 3-year PhD that I'm doing jointly between the UCL Cancer Institute and the Wellcome Sanger Institute, both in the UK. And I'm very fortunate to have this time at the moment. And so my personal journey will be at the end of my PhD, I'm going to go back into training and complete my final years to specialization. So with that out of the way, I'm seeking to address essentially the 2 major routes to specialization or being recognized as a specialist in pathology and related fields in the UK. The first being the route that I've essentially undertaken, which is seeking GMC registration and coming down in blue. I'm just going to put on my pointer. Doing your specialty training in the UK, which is the specialty program that I'm currently in. And then having completed the program, done your exams, you're able to achieve what is known as a CCT. And that's essentially a certificate of completion of training. And that is issued by the Royal College of Pathologists and essentially means they recognize you as a consultant. Now, there is an alternative way to doing this, and this is where you can do your entire specialty training outside of the UK. You can complete your same competencies and you can do the Frc Past exams or its equivalent. And then you can go to the GMC and ask them to recognize you as a specialist, essentially recognize you as a consultant. Now, this is known as gaining a CSER. And I'll go into a bit more detail about both of these routes in my following slides. And I just want to address one common question, which is, do I need to do PLAB? Can I do another route, for example, doing MRCP, MRCS? I know a lot of people, while they're working in Trinidad or in the Caribbean, look to do some of these exams. Officially, the GMC's position is that you need to complete the full MRCP or MRCS to use it for registration. And so because of that, I think a lot of people find it easier, and certainly I did, to complete the PLAB exam rather than going through the full MRCP or MRCS. And that's because those exams are not required to work in pathology or hematology, virology, infectious disease, most of those other related specialties. So essentially, you'd just be doing an exam that won't have that much added benefit if you're trying to get into the specialization early. So in terms of that first route, the route that I took in terms of specializing completely in the UK, the first and minimum requirement is to get your GMC registration. And to do that, you need to complete the PLAB exam. This is the exam just essentially to show the GMC, which is the medical board in the UK, that you are safe to practice in England. There are two parts to this exam, and the first part, or PLAB 1, is very much like Step 1 that's done in the US, or your final written exam when you are leaving university. And so it's a multiple choice exam. It's issued 4 times a year, and they haven't released the dates for 2022 as yet. But you can see here it generally follows 1 exam per season, and you need to apply at least once 1 month in advance. And so this exam, you apply through the GMC, through their online website, and there are a few little checkbox exercises that you need to do to register for the exam. You need to show them your primary medical certificate. Once you're applying from overseas, there's always an issue of whether you speak competent English. And sometimes they ask you for what is known as the Ielts exam. Now, Trinidad, of course, is an English-speaking country, and I think most of the other countries in the Caribbean that are primarily English-speaking are exempt. I've had a few colleagues been given a little bit of pushback about this from the GMC, but in my experience, I simply gave them a letter from my university saying, look, all of our courses are taught in English, she's practiced in English, she's fine to work in English, and they were happy to accept that. So the curriculum that's covered by PLAB Part 1 is essentially, as I said, basically all the medical specialties, everything you are expected to know leaving your medical training. And it's basically what is covered in your first aid for step books, in your Oxford handbooks, and the exam costs £250, but you need to go to essentially the UK to complete it. It's offered in a few other centres, but practically speaking, for people coming from the Caribbean, the UK may be one of the closest centres. Otherwise, you're looking at Canada or other sites in the East. If you're able to be successful at PLAB 1, you can go ahead and apply for Part 2, and you can do them back to back if you wish. This is the Osce style exam, and I've put unpleasant here because I do not have great memories of this. It's not a difficult exam. It's just quite long and tedious. And especially when you want to go into some of these specialties like pathology and so forth, it's quite not relevant to what you do in your day-to-day. But of course, if you're ever needed, and I think we really see this now with COVID, if you're ever suddenly pulled back onto the ward, you definitely need to have these basic competencies. And so they give you essentially a mix of scenarios, and you're just going door to door through different stations. Sometimes you might be presented with taking a history from a patient, doing a physical exam. There are always some counseling sessions where you need to talk to people about prescribing them drugs like oral contraceptives. I'm sure by now there is a session on counseling about taking a vaccine and so forth. There's always a session on delivering bad news. And I think just want to point out here that it's not just about what you would normally do on the wards here, which I'm sure is perfectly fine and acceptable. And because I went into this exam thinking the same thing, I'm just going to handle these scenarios the way I would on the ward. But what they're looking for is the British way that they do things. And I think that can be tricky for people coming from the Caribbean, essentially overseas, because we get a lot more responsibility in our day-to-day work than a British trainee does at the same level. So whereas we would feel a lot more comfortable saying, oh, I would do this, I'd order these tests, this person needs to go for an X-ray or a CT and so forth, they expect you to say, oh, well, I'm going to consult with my registrar, I'm going to run this by my consultant, I'm going to need to consult someone about this, and they just want to know that you are safe to practice. And my final point about this is that they do score you quite meticulously, and I've just highlighted here interpersonal skills. So it feels rather unnatural in the exam, but they score you on things like walking into the room and smiling at the patient, or trying to make small talk if you've got a child patient, developing a rapport and so forth. And so it's something that you just need to take into consideration to kind of get top marks in this exam, because it does go quite quickly. A lot of people have asked me, should you attend the course? I think for Part 1, you absolutely don't need to. But for Part 2, I think it's something worth considering depending on how long you've been out of clinical practice. For example, I had been solely working in pathology for at least 2 years. I hadn't seen a patient that wasn't on an autopsy table in that much time. And so I did a course. And what I would say is that it's definitely worth for people who've never worked in the UK to at least consider doing a mock exam. Now, they hold these either in London or in Manchester, where the exam is based. And it's essentially preparing you to get the most points in the exam. It's not trying to teach you medicine, it's teaching you how to rack up those points. And I think for that point of view, it's useful. And when you look at the cost of the exam, it is £900. So it's not cheap. And you also need to travel to the UK. So it's worth making sure you can get this passed in one shot. So now that you have done your part 1 and part 2 of the PLAB, you're actually GMC fully registered. You are eligible to apply for specialty training, and that goes for training in any specialty. And so there are 2 rounds of applications each year, and that's for all of the specialties across the board, pathology and clinical specialties. The first round usually opens in November, and the second round opens in spring, so February to March. And the first round is usually just for UK-based applicants, and by that I mean UK citizens. And then so in the second round, any spots that aren't filled are open to persons overseas. And so all of this is run through this portal, which is known as Oriel. And I've just put the link here because that's where you would see when these positions are coming up, and they put the details in terms of what they're looking for in candidates. That's where the application forms are and everything. And you can enter into most of these pathology specialties either at the very bottom level, which is ST1, and that's the first year out of 5, or you can enter kind of midway, which is ST3. And of course, what you need to show them to prove that you're ready to enter that level varies with the level you're trying to enter at. And so once you've applied for these rounds, essentially you're looking to start in this position the following August. So it's good to know when you're planning if you're looking to enter one of these programs. And how it works in the UK is that there's one unified system. Everyone applies through the same portal. We all do the same application. And if you are shortlisted, which means that you've achieved enough points through your online application, then they invite you to interview. And everyone across the country comes to the same interview center, which happens to be in London. And based on your final results, you get ranked. And based on that ranking, it lets you know if you've been able to enter specialty training and also where in the country you've been placed. And so it's worth thinking if you're trying to get into a more competitive place like London or the other major cities, that you need to score quite highly to get the desired hospital that you're looking for. And so I've just put this here because it's actually quite nice that they started publishing this. So this has been released by the training program in the last few years. When I applied, you would get the online application and they would give you an idea of what they're looking for. They want you to have presentations and posters, and essentially they want you to show that you are dedicated to the specialty, that you're really interested in pursuing this, and this is not just a fallback for you. And so now they're actually showing you how they score this. And so they give everyone the self-assessment score to let you know essentially how much your achievements are worth to them. And so I've put up these 3 main areas here. The first one being presentations and posters. And you can see you can get as much as 8 points or as little as 0, depending on how well you fit one of these criteria. So in terms of their thinking, if you do a presentation or a poster that's histopathology related, for example, and you're applying to histopath, that's going to be worth way more than if you have done a surgical or an obs and gynae presentation and so forth. Similarly, an oral presentation is worth more than just doing a poster, and having presented at a national or international meeting is more valuable than presenting at a regional or local, meaning hospital kind of situation. And so in terms of quality improvement, what they're looking for there is evidence of audit type work. This is our bread and butter in the UK. It's kind of built into a lot of what we do, that you as a doctor are looking for ways to improve the service that you're delivering. And so what they're looking for here is that you've been at least a part of some audit cycles, and that you've presented some of this and kind of know how to set up a quality improvement project. And then finally, in terms of publications, again, they're looking for things that are pathology related. Of course, if you're first author, that's worth more than just being listed as a co-author. And really importantly, I think to people publishing in the Caribbean is that try and get your papers, even if it's a case report, in a journal that is PubMed indexed. That's worth more points, not only for pathology, but any specialty training you're looking to apply to. Being PubMed indexed is worth more because it means they are trusting that kind of peer review process. And I've put all of this here to show how important it is if you're thinking to apply to specialty training to get some of this done in advance, because trainees who are coming through the UK system have done their degree in the UK. They get all of this almost naturally. It's built into their workflows that they all have to do audits every year. It's quite easy for them to get presentation and posters dropped on them from consultants, and they get their names on them. Publications, most of them have done at least a summer research project, and so have already some first author publications under their belt. And so I think a lot of the time this is where international candidates slip up, that they don't get enough score to be shortlisted for the interview. Now, if you are shortlisted, that's actually the easy part. I know from personal experience in histopathology, but I've heard this from the other kind of pathology-based specialties, that the interview is essentially the same. They keep it like a tradition. The same scenarios come, and everyone is quite keen to help people prepare for this. So I think once you get enough points on paper and you make it to the interview process, it's a lot easier to show yourself as a candidate that's worthy of getting into specialty training. So once you've entered specialty training, or even if you're looking to do these exams outside of the UK, I think it's just worth briefly touching on the Frc Past Examinations. This is the main examination that's recognized to be a consultant in the UK, and there are Frc Past, that is Royal College of Pathology exams for all of the pathology specialties. So there'll be exam for hematology, for virology, and so forth. For histopathology, there are two parts. The first part is a written exam, and it's fairly straightforward. What they're aiming to test is what you would see in your daily job as a pathology house officer or a trainee. And so I've listed kind of some of the areas that they cover here. But what's really important to them, again, is knowing the way that they work in the UK. And so we have what's known as the RC Path datasets. That is, the college publishes these documents, which tells you for each specialty area how they expect and want things to be reported. And that's kind of proven evidence-based as the best way to do things. And so that's really highly tested in these exams. And so if you're not working in a UK system, it's worth really getting familiar with the RC Path website and looking at their documentation. Now, part two is your exam that's much closer to your end date. It's normally taken in your fourth or fifth, which is your final year, and that's showing the college that you are ready to be an independent practitioner, that you're ready to be a consultant. Now, this exam is quite challenging, even to people who practice and train in the UK. So the pass rate over the past few years has just been between 1/3 to 50%. The exam is not cheap as well. So most of us have been told to prepare to spend twice on this exam. And that's just because it's a 2-day exam. It's quite grueling. And it's just a luck of the draw. It depends on what scenarios they give you if you're ready for it. And you need to pass every single section. So it's not just about making up enough points. It's showing that you are good in each of the areas that they're testing. And so that is where a lot of people have concerns about, can I take this exam if I'm not in the UK? And so leading on from that, I want to briefly touch on the point of observerships. Maybe you want to spend a bit of time in the UK and just get a feel for how the practice is, especially if you're looking to prepare for some of these exams. Now, observerships may perhaps be less common in the UK than they are in the US, and they certainly need to be arranged personally with a consultant or a department. So you need to reach out and make that contact or have someone to do that for you. Depending on the amount of time that you want to spend, you will need to have a visa for this, and the hospital has to agree to be your sponsor. So they need to go to the Home Office and say, yes, we take responsibility for this person coming in to do this. GMC registration is not necessary, but sometimes HR feels a bit more comfortable about setting up this arrangement if they know that at least you are licensed to practice in the UK. And of course, observerships, they're unpaid positions, and it's hands-off. So you're going, essentially, you're shadowing consultants and other trainees working in the department. And because of this, you really need a consultant who's willing to take you on. And it's normally for a period of about 1 to 3 months. An alternative, if you want to get a taste of what it's like to work in the UK, especially before your exams, is to do something similar to what I did when I first started, which is looking for a locum job in the UK. They are advertised quite frequently, and they are very open to taking people straight from overseas, provided that you are GMC registered and you can show that you have at least some experience in the specialty. These posts are normally for at least 6 months to a year. So it does mean if you're working in the Caribbean, there might be some HR implications in terms of taking on another job. But it's definitely a way to at least fund your time in the UK and get the genuine experience. If you are a locum in most departments, you are treated like a trainee, so you get access to all of their training opportunities, all of the research opportunities, and so forth. And so some people find it quite useful. And just to say that the Royal College themselves have kind of recognized the value of this, and they've put together this initiative, which is called MTI Path. And so that's for people who want to spend up to 2 years in the UK getting a feel for the system. And so it applies to people who've had some experience in pathology, and either you've already found a job in the UK and you want them to act as your sponsor for your visa, or you haven't found a job as yet and you want them to place you in a job for pathology or any of these specialties listed here. So the good thing about this initiative is that, particularly if you've sat part 1 of the FRC path already, they expect you to take part 2 while you're with them, which means you have 2 years, you're being paid to work in the UK, and they're essentially training you to do this exam because they know that's why you're there. The only thing to note with this is that you must return home after your period of MTI. Essentially, it's like an exchange program, so you can't suddenly take up a consultant post in the UK after this. And finally, I want to talk about the complete alternative route, and that is fully training, not in the UK, and then looking to register as a consultant pathologist in the UK. And as I said, this is applying for a CSER, or Certificate of Eligibility for Specialist Registration. So you're going to the GMC and you need to show them that you have done everything essentially that is in my or the UK histopathology training program. And I've seen a lot of people do this. It's quite a capable goal to do, but it just needs a bit of forethought. And that's because you need to show evidence for everything that you've done in your specialty training. You also need to have this evidence verified by a supervisor, which is usually a consultant or someone who's been working with you in your training. And the GMC notoriously contacts everyone. So you do need to work with someone who's going to respond timely to them and who is willing to kind of back up all of the evidence that you've provided. And just finally, briefly, another stumbling point that you need 4 referees, usually consultants, and they need to be able to fill out these detailed reports with specific examples about how you've worked. And so again, it's just something about, if you want to take this route, knowing in advance, I'm going to need to prepare my consultants, that I'm going to have to get this paperwork done and so forth. And just briefly, I've put this here more for a reference, but just to show you the kind of evidence that you need to show for every year you're in a training program that's not in the UK. So for example, you need to keep all of your logbooks, you need to keep examples of the autopsy reports or case reports that you've done. You need to have feedback from other colleagues. You need to do what we call workplace-based assessments, which is where, for example, you have written proof of a consultant saying, yes, she's safe to do an autopsy, yes, she's safe to do a report, and so forth. And these are things that we do in what we call a portfolio in our UK training program. But they're looking for the equivalent from you, regardless of where you've trained overseas. And so just gathering all of that together for all of the years that you've trained away, sometimes people find that quite challenging. And then I've similarly highlighted the 2 other domains. Again, just showing that you can provide evidence for all of these things is usually the stumbling block. So if you're trying to take this route, it's worth knowing in advance that you need to keep abreast, because it's quite difficult in your final year of training to get this together for all of the years that you've been there. And so I've just quickly summarizing, I've put all of these links in. I am going to make my slides available for all of the various topics I've hit throughout my presentation. I want to give a very brief plug for the Pathological Society of Great Britain and Ireland. I am a trainee subcommittee member, and particularly I help to organize the conferences that we host. We're hosting one in January of next year. There's a call for abstracts that's out now. And because it's a hybrid meeting, you can submit for posters or oral presentations. And I think we will have some capacity for presenters who are overseas. I would really encourage it. And I would encourage people to join as a trainee or even an undergraduate member, because we are working quite hard to put a lot of our content in the UK available on our online platform. You also get access to various journals. You get good opportunities for research. They're partly the reason why I've been able to do so much research coming from a background where I had no research experience. And they do also give good opportunities if you want to get observerships and so forth. And so I'm going to bring my presentation to an end. I feel I've gone a bit over time, so thank you guys for humoring me, and I am very happy to answer any questions.
Good evening, everyone. If you have any questions that you would like to ask Dr. Dinoon regarding the UK route of specialization, the floor is now open. We are kindly asking that you either put on your mics and ask your question, put on your mics and your cameras if you're comfortable, and when you're finished asking your questions, turn both your camera and mics off, or you can simply put your question in the chat.
As we have a bit of time while people are getting their thoughts together, I just want to say for people who perhaps have done some pathology in Trinidad, the practice is very similar. So I think actually working there is not something to worry about. In fact, a lot of pathologists that I have worked with have found that people who come from overseas tend to be a bit better, to be honest, than the UK trainees. And I think that's just because we have a lot more of a kind of go-getter attitude, you know, something as simple as chasing a result, which we do, you know, all the time. UK trainees won't think to do, they won't think to pick up the phone and so forth. So I think once you get there, it's a really great opportunity, and they are really happy to have overseas candidates. And we are quite strong when you place us against some of the local trained persons.
Thank you, Dr. Dinoon. We have our first question, and this person is asking, what is the process of specializing in internal medicine using the UK route?
So I can speak briefly to this. So specializing in internal medicine, or most of the medical specialties, you have to enter what is known as the core trainee program. It's very similar to what I've described for pathology, whereby you have to get GMC registered. You go through that same Oriel portal and you fill out the online application. And it's just what they're looking for in that application is a bit different. Again, you just need to show that you're committed to whatever specialty you're trying to enter. Once you do that core training for 2 years, then you have to apply again, unfortunately, and go into that subspecialty, be it respiratory or whatever you're interested in.
Okay, thank you, Dr. Dinoon. Our second question is, will the UK MLE replace the Plaid exams? And what would the UK MLE exam be like?
So there's been talk about the UK MLE exam for some time. I'm not personally familiar with it. And that's just because the GMC is still holding their PLAB exams, and they haven't made the official announcement to moving over. I think there's always been a plan of kind of doing a more standardized exam that's not just, you know, linguistic based, not just assessing your practice in English. But as yet, that's not the dedicated route to go to, so I can't speak too much to it.
Okay, our third question is, what is the best way to obtain research opportunities as an undergraduate?
That's a really good question, because I when I did move, I was like shocked at how many people already had research experience and I didn't, and I was very fortunate to have people to take the time to bring me up to speed. I can't speak to UE and the opportunities that they are on campus, but in SGU, I think looking back, there's certainly, it's just about showing the initiative and approaching your professors, approaching your lecturers, because all of them do need to have continually doing some research to keep their posts. And that means they're always looking for people to kind of help them with that. Next to that, it's making some links overseas. And I'm very fortunate that I've been able to get to a place where I can help others do this. And so I think that's something that I'd actually be really happy to speak to the Pathology Club if people are interested in maybe partnering and helping people get some experience in research early on.
Okay. Our fourth question is, how successful has the route of CESR for UK IMG residency programs such as DM pathology in UE?
Okay, so I personally do not know anyone who's done DM pathology and applied for CSER, but I do know other people who have done DM for other specialties in the Caribbean, be it Mona, be it in Trinidad, and have been able to achieve kind of the equivalent of CSER. But again, some people, it takes a lot of time just because you apply to the GMC and they're quite kind. They won't reject you, but they'll say, we need more paperwork. We need more paperwork. And it takes a while if you haven't been preparing to gather that. And so I think if you want to do the DM and go for getting registered as a consultant in the UK, it's just worth thinking about making sure you have your records lined up.
Okay, thank you, Dr. Dinoon. Our next question is asking, what are your thoughts on doing F2 standalone instead of a locum job?
I think F2 standalone is perfectly fine. I think that's something that I would have thought of if I didn't already have enough experience in pathology where I felt I could go straight into a department. F2 standalone is nice because they give you some rotation. So you might get 2 or 3 posts, which means you might work in different hospitals. You meet a lot more consultants. And again, you just get really good experience during your time there.
Okay, thank you. Our next
Yes, thank you so much, Vanessa. Good night. My name is Cariska Zo. I've been mentored by Dr. Walker. I've already done my PLAB 1, PLAB 2. I'm already GMC registered. Currently applying to the UK for jobs. And I found difficulty because of that no research. I found difficulty securing a pathology post because of that. Not having the research background, not having any, anything at all, because of that lack of experience. So is there anything that I can do now? Of course, yes, I can get into maybe doing some presentations or so, but.
Yeah. I think that's a good question. I was very fortunate in that the first place I applied took me. I was quite grateful. I did have some case reports published, actually mostly with the surgeons in San Fernando and of course with Professor Daisley. And I think case reports at the very least, it's just something filling up that spot in your portfolio or your CV. And I also think just before I ended up migrating, I submitted an abstract to TTMA, and I got that accepted for an oral presentation. And again, that just shows up as a national presentation. I find it funny that they are not a bit more flexible in pathology, not having that experience. Maybe there's a bit more people applying for jobs now than I have been. But in that case, I mean, if you want to, please feel free to contact me. And I think at least we can start getting some things on your CV and hope that's a bit more useful.
Yeah, that would be greatly appreciated. Thank you so much.
Thank you, Dr. Kazo. Our next question for Dr. Dinoon is, how do you get to present at national conferences?
Okay, so I had to hunt around, and as I said, the only one I found when I realized I needed such things to move to the UK was the TTMA, Trinidad and Tobago Medical Association. At least when I was here, they had annual conference, and they were accepting abstracts. Past UK is a really good way to do it, because you can partner with someone like myself or people I can introduce you guys to and become co-authors, which means that even if you can't go to the UK to present, someone can present for you, and you both are able to list that on your CV. And PASOC is pretty generous with at least posters accepting internationally, and so it's just a good way to get it done. For example, the conference we have coming up, I've done most of my abstracts in a night or two. And so I'm quite happy to help people at least put together something, and then you have a bit more time before January actually putting the poster or the presentation together.
Okay, our final question is it possible to do both F1 and F2, even with full GMC registration, to allow for more rotations?
So yes, you absolutely can apply to do F1 or F2 with just your medical qualification. I am not 100% familiar with that route, and apologies for not covering that option of doing that fully, because I had done my internship, and I think because most of us, kind of need to go to our respective homes to do the internship. Perhaps you do lose a bit of value there, but definitely if you want to get into the UK system, that is a way to do it. I think that, again, the F1 and F2 is a bit more competitive than going for a locum job, but it's not impossible.
Okay, sorry about that. There's one final question.
Oh, I see it. Sorry. I'm so used to saying PASOC. So it's the Pathological Society, and we just shorten it to PASOC. But yes, the website I actually think is PASOC, PATHSOC. And I've put that on my slides as well, for people to have that as a reference. And I'll probably just pop it in the chat as well.
Okay, I see Dr. Walker has his hand raised. Dr. Walker?
Hi, good afternoon, everyone. Congratulations, Dr. Denoon, on an excellent presentation. I'm Alfredo Walker, forensic pathologist in Ottawa. I did my postgrad training in histopathology in the United Kingdom many, many moons ago, when things were much different compared to they are now. So I just wanted to take the opportunity to point out some of the salient differences between when I started my training back in 1999 versus what has occurred in the last 10 years or so. In the part 2 of the examination, UK candidates, as far as I'm aware, can now opt out of doing the autopsy component and the cytology component, correct?
Yes, that's correct.
Yes, so
those are optional modules.
So in my time, you had to sit all parts of the histopathology exam and pass all parts in order to pass the exam. However, they realized about 15 years ago that although they went to great pains to set up practical exams, the autopsy component, where people would fly from Birmingham to Belfast to do a practical exam on autopsy, the vast majority of graduates did not perform coronial autopsies. So as a result of that, they made training in autopsy pathology mandatory, but with an option to opt out of the exam. And those who want to do autopsies, you have to do an additional exam, which gives you an additional certificate, and the same applies to cytology. So I just needed to point that out to anyone who's thinking about going the British route. You will have to train in all disciplines in anatomical pathology / histopathology, but you can opt out of doing the autopsy component and opt out of doing the cytology component, which means that once you get your FRC part without autopsies, without the autopsy component, officially you would not be able to perform coronial autopsies after. And if you opt out from the cytopathology, you would not be able to report cytopathology. So just be aware of that.
Yes, thank you, Dr. Walker. That is definitely an area I feel to cover. And I just want to clarify that it is gynae cytology that you can opt out of, but you must do the non-gynae cytology component in your standard FRC Path exam. And also, if you do complete your FRC Path Part 1 and Part 2, and you don't do the autopsy specialization at the time, at any point in time during your consultancy, you can technically go and do the exam and now be fully qualified to do autopsies. It's just that consultants hardly ever take that route.
Thank you, Dr. Walker. Thank you, Dr. Dinoon. Our very last question that someone just sent in is your UK specialization valid in countries such as Canada, Australia, and New Zealand?
So I won't speak to Canada, and maybe other persons on the call, like Dr. Walker, can clarify that. It is accepted in Australia, but again, it's a matter of doing this conversion where you show all of your evidence, you show your examinations, and their medical board needs to accept it. So while you can practice, it is, just a little bit of a step in terms of making sure they recognize the qualification.
Okay, thank you, Dr. Dinoon. Okay, everyone, Dr. Dinoon did a fantastic job at answering all of the questions asked. And since there are no further questions at this point, I will now hand you over to Demiola Pacheco, who will introduce our next speaker for this evening's event.
At this time, ladies and gentlemen, I am privileged to be introducing our next speaker this evening, Dr. Rondell Graham. Dr. Graham graduated with Bachelor of Medicine, Bachelor of Surgery, MB.BS degree from the University of the West Indies, Mona campus, after which he completed his residency in Anatomic and Clinical Pathology at Mayo School of Graduate Medical Education. He then went on to complete fellowships in Molecular Genetic Pathology, Surgical Pathology, and Gastrointestinal and Liver Pathology at the same institution, where he currently serves as Associate Professor of Laboratory Medicine and Pathology. Dr. Graham's research includes the molecular genetics of liver tumors and respective biomarkers of diagnosis, treatment, and classification. Dr. Graham, along with a team of investigators, uses various approaches to evaluate and understand liver tumors such as fibrolamellar carcinomas. His work is geared to what we all hope for: improved diagnosis and clinical outcomes by liver tumors. Without a doubt, Dr. Graham stands humbly and proud as a mark of excellence in the field of pathology. We are all honored, pleasured, and privileged for him to be here with us this evening. Ladies and gentlemen, I ask you to welcome Dr. Rondell Graham.
Well, thank you for that very kind introduction. I appreciated Dr. Dinoon's presentation, and listening to your voices through the chat has reminded me of how much I miss being at home. For this time together, or for our time together, what I thought I might do is kind of maybe tell people a little bit about myself. And I didn't prepare any slides for that, but a little bit about myself, a little bit about what needs to be done to get into the US system, and then kind of try to take questions. I think Dr. Dinoon did a very good job of presenting what you need to do to get into the UK. The US is somewhat different, but I think there are a lot of important, I would say salient things that are similar. So a bit about myself. So I graduated from UE Mona, and I did everything at Mona. I did my internship there. I was a senior house officer there, and I worked in the pathology department for a year while I did my US MLEs, and then I applied for residency in the US, and I interviewed at a number of places, and I ultimately was offered a position at Mayo in Rochester, Minnesota, which is where I live now. And I started my residency there. I did my fellowships here, and then stayed on the staff. So I've been on the staff for a little more than 5 years, and I do GI liver. I train in GI liver, molecular, and general surgical pathology. I direct the section of GI liver pathology, and I'm in the vice chair research role, and I do some other administrative type things here. So that's my background and what I kind of do. In terms of what one needs to do to get into the US system, I think once you finish your MB.BS, and you could even start before you finish that, I think you need to complete your steps. I will say the crucial differentiators, you want to score as highly as possible in your steps. And I think a crucial differentiator is to complete your step 3 before you apply. Why that's a crucial differentiator? Of the international medical graduates who will struggle, the majority of them struggle with step 3. And so that's one of the things that programs will look at to differentiate international medical graduates who are strong candidates and those who are not as strong. And then, of course, the scores. The higher the score, of course, the stronger the application will be perceived. The other component will be observerships slash visiting rotations. I think those can be helpful. What's most helpful is if you do them and the places where you rotate, you obtain a letter of recommendation. So I think those letters matter a lot if they're from colleagues in the US. And then I would say research experience is really, really helpful. Having presented an abstract at a national meeting or an international meeting, that's a positive thing. And if you have actually taken it all the way to having it published in a peer-reviewed publication that's indexed in PubMed, that's a very powerful, positive feature of your presentation. I would say US experience is really a positive if you have that. Presenting at a US meeting is really positive if you have that. And publishing in a journal that is, well thought of in the US is also very positive. I would say those are kind of the crucial things. I didn't have any US experience before. I was just in Jamaica the whole time. And I think people can match coming from that background. I think once you've done your steps and you get your scores back, if you believe you've done well in your steps, I think you need to apply widely, apply to a lot of programs. I would say, you want to apply to something like definitely more than 20 programs, of the order of 40 programs. 50 programs is probably a good number. I would accept all the interview offers that you receive, at least in the first instance. And I think at the interviews, you want to put your best foot forward. I think you want to prepare for behavioral type questions. And it's useful if, as part of your work or your career development up to that point, you have participated in some kind of quality improvement activity, similar to what Dr. Danoon mentioned. I think in general, there's a lot of enthusiasm around candidates who have participated in a project that has improved the quality of an outcome or the quality of something that can be measured. If that's published, that's really fantastic. But if you have done that in a bit of work that is unpublished, that's still really important. So those are kind of the things I would say that are really crucial about differentiating candidates. I think you want to do your steps. I would recommend doing all 3 steps if you can before. I think having research experience is helpful. By the time I had applied, I had 1 peer-reviewed publication in a PubMed Index journal. I had 1 in WIMJ. I don't know if WIMJ still exists, but that's not peer review. That's not a PubMed Index. And I had presented an abstract at the ASCP. That was in Baltimore the year that I was interviewing for residency. And I think those are kind of like key ingredients. Any questions on, or about that, or maybe anything else? No questions? Should I continue?
Good night, thank you. So my question was about USMLE Step 1 in particular. I saw that it was changed into a pass-fail system as of 2022, and I'm just wondering, like, how do you think that would affect us as international med school graduates, and if there's anything we could do to compensate for that lack of a competitive edge from that score?
Yeah, so I think that's a good question. I think I would do the exam, and if not that the exam is pass fail, and I think that's a good question. I think you have to, I would say, put your best foot forward. I don't think the that's the end all and be all. As I might have mentioned, I think probably in the era when I was so I should have mentioned, I graduated from UE Mona in the class of 2006, and so then I went into my internship. And so I started my residency in the US in June 2009. So I did internship, senior house officer, and then one other year. I would say that in that era, having a good step one score was kind of a differentiator for pathology specifically, because it's, many people's minds there was more pathology in step one than in the other parts. I would say since then, the major differentiator for IMGs is whether or not they've actually passed their step three. So I think the actual score for step one may not be as crucial, know that it has been kind of phased. I said a crucial edge is having passed your step three. And now all of the residents are expected to pass it by the second year of training. There's the question in the chat about when is the best time to do step one. I would say you can do step one during your training, and I think it's totally fine. I think it's good to do your exams probably within a year or 2 years. If you do them very far apart, sometimes that raises a question in people's mind as to how committed you are to being in the U.S. or to how much atrophy might have taken place. So that's what I would say relative to those step one questions. What do you recommend? Yeah.
Hi, Dr. Graham. I have a question just out of curiosity. I do know a few people who are training in the States, and what always struck me is that a lot of people seem to do a dual degree. So we don't do any essentially clinical pathology, what we call like biochemistry and so forth.
Right.
And I know that's especially important if, say, you want to come back home and be head of department or run a lab yourself. Can you speak a bit about that kind of experience in the US?
Oh, that's a great question. That's a really nuanced question. So in the US, if you apply for residency, most often people are applying for APCP. That's what most people do. So that includes anatomic pathology, which is what you imagine it is, and clinical pathology covers, in the US, when they use that term, they're covering chemistry, microbiology, that includes genetics. Heme path kind of straddles those two areas. So most people do both. So a lot of the training relative to lab directorship is in CP, at least in the first instance, before people do their fellowship training. And I think I did APCP. I would strongly recommend people to do that unless they're absolutely certain that they definitely want to do more clinical pathology. I think that was a really good open door for me, because I think it gave me exposure to molecular pathology, which I ultimately did a fellowship in, and that's a big part of what I do now for my career. And I think the training is a little bit different. I would say anatomic pathologists are focused very heavily on pattern recognition and morphologic diagnostics. People who do clinical pathology, of course, are focused on a broad range of things, and I think it kind of adds some perspective. And that perspective is really crucial to things like directing a lab, validating a test, lab management, and that particular set of skills that are really, really crucial if you are going to be involved in leadership, or you're going to be involved a lot in administration, or if you're going to be involved a lot in research that bridges a gap between anatomic pathology and another specialty. So in the US, that's a very common thing. Now, my friends from Canada would say, and from the UK too, who were trained there, would say that the US pathologists, when they complete their APCP, that 4-year training, they have less anatomic pathology training than counterparts in the UK and Canada, and relatively are weaker than colleagues there. And that may be true. And I think maybe for that reason, that's probably one of the reasons many US graduates will do a fellowship in a focus area. And I think that's very common. So something like 95% of US graduates will do at least one fellowship. About 2/3 of people, maybe 60% of people, will do 2 fellowships. I actually did 3 fellowships. I don't know that I recommend doing 3 fellowships. It's kind of crazy, but that's certainly an option that is available. I see a question in the chat about what exactly does step 3 entail. Step 3 is kind of funny to me. When I say funny, kind of humorous, because it's a lot like step 2 CK, in my memory at least, in that it's a lot focused on these clinical scenarios and what you would do. It's considered to be the equivalent of your final board exam to say you're safe to go practice in what will be an outpatient setting or a hospital setting, inpatient, I think it's a lot of revenue generation for the Board of Medical Examiners. That's what I think, at least. But I think it's a pretty straightforward exam. But I think the closer you do it to steps 1 and 2, the better, because a lot of the questions or the kind of knowledge is, similar. I would recommend, like I said, doing that as early as possible because it does give you a competitive advantage over all the other applicants. Any other questions? I must say this is really well organized. I'm amazed at how many people are here with an interest in pathology. It looks like there are more than 75 people online. That's incredible. Year or two. It's a really good question. So for pathology, to my knowledge, you are eligible for a residency position once you have completed the USMLE 1 and 2. I think you're eligible for a residency and you've completed your full application. Dr. St. Louis is asking, first we do step 1, step 2, and step 3, and then we go to apply for rotations. I think that's a reasonable approach. I think you can apply for rotations as a medical student or a visiting medical student almost at any time. You don't have to have done any steps. I think doing visiting rotations can be helpful. Many people do them, but I will say that they're most helpful in the US if at the end of that rotation, the people observing you write a letter saying that you're a strong candidate. Um, if you don't have that deliverable at the end, it may not be as helpful. So for instance, in our program in Minnesota, we have sometimes more than 500 people apply for our 7 residency spots. Now, lots of people who apply are applying many places, but many of them have either they're US medical students or they have observership experience elsewhere. I will say the things that are very differentiating are the things that I mentioned before. If they've done their step 3, if they have high scores, if they've presented an abstract or multiple abstracts, or they've completed a peer review publication, that's very, very strong. Applicants sometimes can be very strong if they've done a very focused amount of work in an area. That might be academic work or maybe working in areas with underserved patients or focus on topics that are really important or really popular, like the underserved, the vulnerable, health disparities, or topics that have a lot of, or areas or platforms that are keen interest, like artificial intelligence and so on. So I would say there's some focus points that kind of like are really helpful, but visiting rotations may not be as helpful without a letter, except in the scenario where you are applying to the place you visited. That's really helpful because they will know people who have met you one-on-one and so on. Was that a helpful answer? Yeah. Yeah, so I would do the USMLEs either during or after your internship and just kind of do them like that. Now, I don't think the USMLE exam has changed a lot. And I remember around the time I was doing it, people were very worried. It was like they were going to have to start over medical school again and stuff like that. I actually found the first aid books and the USMLE question bank to be the really helpful things. I just used those 2 things and I thought it was fine. And I think one of the things is that if you've gone through your training in the Caribbean at UE, at least my perception of the experience was if you went through your training and you were working diligently on your training, you'll be able to answer the lion's share of these questions pretty comfortably. Doing the question bank is really helpful. My recollection is that some of the questions for the question bank were in the exam, or very similar examples were in the exam, and I thought that was plenty. So the idea that you are post-internship and you're going to go back to all your biochemistry notes and so on, like I think that's a little bit extra, a little bit excessive. I think if you cover the first aid book, you cover those questions in the question bank, and I think the question bank gives you feedback, like how you're scoring, and you're doing really well there. I think you're going to be ready for the exam. And one of the pieces of advice that I recall receiving, someone told me, don't think about this too much, just do it. The best way to do it is to do it. And that's what I did. And I would recommend that approach personally. I think you don't want to psych yourself out of doing these exams. My experience too, working here as a resident with, I thought, excellent colleagues, I thought that the people I trained with in Jamaica were just as talented, just as capable. And those people were from all across the Caribbean. So I don't think you need to be too intimidated. I think you just need to put your best foot forward. And to Dr. Danoon's point, my experience with people who have trained in the Caribbean is that in general, they're pretty driven and pretty hardworking. Their work ethic tends to be very high. So I think that's important food for thought. Okay, so I would say there are differences between places and how you can visit and when you can visit. So in some places, they will only accept people who are actually in medical school in a visiting medical student type rotation. So if you've finished and you've done your internship, there are some places that there isn't a straightforward route to do a visiting rotation with them. So I think if you are really strongly desirous of doing a visiting medical student rotation, I think I would try to do that before you finish your 4th year. I didn't do that, and I know many people who've matched who didn't. So I'm not like, I'm kind of like neutral on that particular course of action. But if you really want to do it, I would recommend doing it in your 4th year. I think if you have already completed your medical training, it's still an option, but I think you probably need to email the school or contact the school and find out from them how feasible it is. Schools have the authority and the autonomy to have their own rules. So and to change those rules. So at Mayo, for instance, we used to accept people even when they had finished their medical school. We had a person do a visiting rotation when I was a trainee who had finished medical school like 7 years ago. And that was possible. But now those rules have actually changed at our program. So those rules can change. I think you have to reach out and contact them. I think the more compact your application is, the better overall. That is, if you have done your medical school steps, and then you move up or you're applying for residency, in general, that's generally more attractive. There is a case to be made for completing completing everything and even potentially, quote unquote, starting over. That is, like, you've done some pathology residency training or even a DM exam and then trying to apply. That can work as well. But in general, people who are doing that tend to find the steps more irritating, may not score as highly in the steps, and that will change your attractiveness to prospective residency programs. So I think the more compact, the better, if that's helpful. I would say the fastest route would be to do your steps while you're in medical school. You will, by the time you complete your MB.BS, you'll probably be pretty close to doing your step 2 CK. I would do your step 2 CK during your internship. In my experience, the step 2 CK is less difficult than doing your MB.BS exam. And then doing your step 3, which is very similar to the step 2s in my experience and in my memory, and then applying for the next cycle. So you would do probably your 1 year internship and maybe 1 year of service, and then you're off to the races. The US application doesn't take very long. I think you could, in theory, because there are these windows that are open when you go through the process of applying, I think in theory you could probably do everything in an 18 months or 2 year kind of time frame. So the US application doesn't take very long at all. It is up to you, though, to determine the tempo of that. And when you go to apply for USMLEs, they'll let you know when the windows are. There are certain windows, and it may take several months before you hit the next window. So I would say my strategy, or the strategy I would recommend, is set a date to do the exam, then start studying to meet that date, and then kind of roll like that. I would say do step one, see what that experience is like, then set a date for step two and continue to roll like that. How long are the results valid for? I think once you've passed, that's a good question. I don't remember that off the top of my head, but I don't think I would think once you've passed, they're valid for a long time, because I don't know anyone who has had to redo their exam having passed. I hope that's helpful to Dr. Bourgeois. Hi, Catherine.
Yeah, I could clarify about that point. It's valid for 10 years. That's it. So if you
Awesome.
get a low score, it's with you for 10 years. That's how it works. I'm out.
It was good to hear from you, Catherine. So, I had the pleasure of Catherine. Well, we kind of overlapped in Rochester when Catherine was a CV fellow with us in Rochester, Minnesota. I think that's a great question. I will say that we are in a time now where being from less developed or more emerging countries is probably an attractive option. I think now, in terms of the data and the metrics for programs, when they're considering the underserved areas and so on, they're usually focused on areas within the US. But I do think that people will consider that as an important part of their mission to train people from different parts of the world. I think that they will consider that attractive. I think, excuse me, I think when you're interviewing, it's important to put your best foot forward to illustrate your work ethic, your interest in teamwork, your passion for the field. I think if you are communicating those things, they come over as sincere. And if you have objective evidence of those things, it's really effective. I will say people who have worked in things like Cancer Society, where they're either collating data or providing support for patients, where you're doing you have a work experience that shows compassionate care for the underserved and so on, that shows some creativity and some extra effort, is a really profound thing. So most people who are from the US medical school system will have done their steps and they will apply, and they'll kind of have that advantage, as it were. But if you're going to the extra effort, volunteering at the Cancer Society, involved in some patient care activities, working on research, things of that nature, they kind of like are impressive, especially if they're substantive. So I don't think you need to do many things. I think if you do one thing and it's really substantive, it matters. I don't think you need to do many papers. If you've done one original peer-reviewed publication and it's really well done, I think that really matters. So I think those are things that really stand out. I would say apply widely. And of course, if you have the opportunity to attend a meeting before your application comes through, and that will be either as a medical student or while you are going through your steps. If you apply or you submit an abstract to the ASCP, the CAP, or the USCAP, or even if it is in the UK, that will be really powerful, because it takes a lot of effort to do those things. And if you've done those things, it shows a sort of commitment to the field, and you will probably stand out. Most US graduates don't have a paper, and I would say few have abstracts. And if you have an abstract and you've converted it into a paper, that's a very strong application. Letters of recommendation too is another thing that can really help stand out. If you have worked with someone who is well known or reasonably well known, and you have worked together, a letter from them will matter a lot. And what's helpful in that letter is for them to be able to give specific examples of qualities that you would bring. And it looks like there's a question from Dr. Fletcher about, is it possible to serve as a research assistant or virtual visiting rotations at IMG? I think it is in some places for sure. That's going to be on an institution per institution basis. Many ways this could happen. You could, because now with the changes that have happened as a consequence of the pandemic, there are people who are virtual assistants. This can be kind of complicated to set up, but I would contact the specific person or the specific institution that you're interested in, and they may be able to set that up, because some data sets can be managed anywhere there's internet access, and you can contribute to the assessment, the analysis, or reporting of that data set from anywhere in the world. And so if that's an arrangement that is attractive to you, you could apply, you could reach out to places, and on a per case basis, they'll be able to give you some feedback on that. And if that's an opportunity, that's something that might work. I think one of the downsides of virtual is that it's possible that people will know you less. So I think you have to put, if that is an option that's working out, you'll have to put some energy into developing a rapport, and maybe have some virtual touch points with with the people that you're working with, so that they get to know you, because that's crucial, I think, to the notion of what kind of letter they will write for you and your engagement in the process. But it's definitely possible. I would say if you have good pathology experience and you feel comfortable looking at slides and so on, it might even be possible to do digital type projects where there's annotation required. That can all be done anywhere there's internet access, but you'll have to reach out to the specific place to see if it could be set up. In some of these places, you need to have IRB approval. There need to be, some paperwork that needs to be filled. So you have to see how feasible that is. In general, virtual presentations in general may not be paid, so that's something that you need to be cognizant of. But some of them may be paid. It kind of depends on what the arrangement is. Where that's most likely to be successful is in a place where the individual has a lab. They have a research lab that they're maintaining. I hope that was helpful. Oh yeah, we could. When I don't know if UE has changed any of its rules, but when I was a medical student, there were elective rotations. There was an option for an elective, and so you could actually do an elective anywhere in the world. In my time, it makes me feel old to say in my time. Like when I was in medical school, people would commonly want to go to the UK. Actually, I thought I was going to go to the UK all the way up until I finished my internship, and then I was like, I don't know, maybe I'll apply to the US. So people would go there, and then the other place people would go to a lot is Canada. So those are all options. I think, well, I'll wait and see if there is a last minute question. So that's a good comment here from Dr. Get. It's totally fine and a good idea to join the CAP, the College of American Pathologists. They do have virtual meetings, and I think that is an opportunity too for ASCP to kind of like show your commitment. You can certainly join the organizations. And of course, if you have the opportunity to like present some work or submit an abstract, that's a really cool thing. I will say, if you're, oh, there's another question. This is awesome. Jade Mohammed, you would apply directly. Yeah, for electives, you're going to apply directly to the respective university or medical center. And it looks like Catherine put her hand up again.
Yeah, I just wanted to say before you left, thank you for doing this talk and giving up of your time. I know you're very, very busy. but I know these students truly appreciate, your firsthand experience, because I think a lot of time for them, training is like this mythical thing, and it's unclear and vague how to actually get there. And there's a lot of anxiety around it, and it's expensive. So I think it gives them more confidence to have these kind of talks from people, particularly like yourself, who are graduates from UWI, who can, understand their background, understand where they're coming from, what they have exposure to really help them formulate in their minds how to get there. Because until you can formulate how to get there, it's hard to really aim and put your time into things. You just sort of wander aimlessly, not knowing what to do. And then before you know it, 10 years passed since graduation, and you're like, what am I going to do with my life? So I just want to thank you again so much, Rondell, for doing this and taking all the time to do this. It, was really well done. I think it would be very helpful.
Well, thanks, Catherine. And as hearing you say that reminded me of two other things I wanted to share. Catherine is there, and she's done it. So you guys can reach out to Catherine anytime. Melanie John-Cia should be there. Melanie is really terrific too in Trinidad. And so I'm sure she'll be really happy to hear from anyone about questions about the experience. I would say it's really crucial not to psych yourself out and to overthink it. Like I said, I train with great people at UWI Mona from all across the Caribbean. I actually really loved my medical school class. If you had to ask me if I could do medical school again, I totally would in a heartbeat. And I thought that the people I trained there were just as talented as the people that I've trained with here in the US and worked with, and in some ways perhaps even more talented and maybe even more more highly motivated. So I would say don't psych yourself out. The other thing is, even if you don't have any experience in something in the Caribbean, it doesn't mean you can't do it. So Dr. Danoon, I was really interested to hear her say that she started with no research background, and now she's doing a PhD and focused a lot on research. When I went to Mayo, or when I came to Mayo, I had done almost no molecular. I had extracted DNA from a cheek swab of myself. That's all I had done. And I remember co-residents telling me, why do you want to do molecular? That's crazy. You don't even know what you're getting yourself into. Just basically on an idea, I applied for molecular, and I've loved it. It's been amazing. And I got that fellowship, and that's a skill that I use a lot now in my work. So I would say don't psych yourself out. Just because you don't have any experience doesn't mean that you can't try. So I think that's a really crucial thing. I would say don't overthink it. Set yourself some deadlines, set a time, and do the exams. And the best way to do it is to do it. I think you should talk to Catherine too if you have more questions. People are welcome to email me. They can find my email, and I'll definitely try to respond. In terms of opportunities to participate in research, let's see here. I know we get exposed to research during our time at UWI. I think it's possible to do research almost in any scenario. It really comes down to creativity. When I was at UWI, one of the things we did is we just pulled out all the angiomyolipomas of the kidney, and we just wrote them up, the experience there. And we pulled up all the appendectomies, all manually, to see how many of them were well-differentiated neuroendocrine tumors or were, at the time, we would say low-grade mucinous neoplasms of the appendix. I've seen people do all kinds of creative things. They went and found out the incidence data of things and how they're changing, and then you would create your narrative. You have to kind of create a narrative for your story. Now there's a lot more interest in what's happening in the developing world than there was, 10 years ago. And if you come up with a compelling narrative of something that's happening, that's a research project. So describing what's happening with COVID-19 in rural Trinidad, that's probably of interest in a lot of places. If you can collect all the relevant data that is available to you, that would be really interesting. And you might think, well, we can't sequence all of our COVID cases. You don't have to do that. I would say use exactly what you have. Try to construct what that narrative is going to be. And I'm happy to help out where I can. I'm a specialized now, so I do less and less of things that are not my specialty. But I'm happy to help out where I can and to read things. And I anticipate I'm volunteering you, Catherine, that Catherine and Melanie will be as well. I would say don't worry so much about what information or what data and technology platforms you don't have. I would spend a lot more energy on what you do have, if that's helpful to Dr. St. Louis. Yeah, I fully agree with that. I was going to say, I fully agree with that.
Sorry, I just want to add to the research thing. I know a lot of where people tend to stumble is coming up conceptually with an idea and a narrative. And it does get easier as you have more experience. It's very hard I think as a medical student when you don't really understand clinical significance of things to figure out where to invest your time and whatnot. What I have done with, particularly with Anne-Marie, which will help you to get ideas. Every time there's a meeting, they publish all the abstracts online, and just read through them. Just read through, pick an area, there are a lot, but read through an area you think you might be interested in. Like if you're interested in GI pathology or forensics or just autopsy pathology, look under that heading in, for ASCP or USCAP, and just get a feel of what people are bringing up, what is getting accepted. And I think if you read that, you will realize it's not that bad, right? You're not, expected to discover a new tumor and describe it. Nobody is doing that. A lot of it is really large case series, and if you have a new stain, which you probably wouldn't have access to, but it doesn't have to be that cutting edge technology kind of stuff. So just have a read through some of the published abstracts. You'll get a lot of ideas, and then, as Anne-Marie said, approach somebody in that area to try to get some mentorship. You'll be fine. That's my little 2 cents.
I think that's a great idea, Catherine. I think Dr. Solange put something in the chat. It's been great being here. It's actually great to hear people speaking English as it should be spoken. And it's not often I hear from people in the Caribbean. It's great to hear from you guys. It makes me realize how much I miss home. Thanks for the opportunity to be here.
As we come to close, I hope that you all had a wonderful and learning experience. At this time, the feedback form link has been sent, and we would like you to take a minute to fill it out. It will be greatly appreciated for documentation for improvements to our future events. Alfredo Painter once said, saying thank you is more than good manners, it is good spirituality. Firstly, I'd like to thank our featured speaker, Dr. D. Dune and Dr. Graham, who, despite their busy schedules, graced us this evening with an amazing and enlightening talk where we were all extremely grateful to learn about the processes of specializing in the UK and US. Whilst we are most happy that you were able to give us an insight into the behind scenes of foreign medical specialist training, we are hopeful that your audience was able to take pertinent notes and was reminded, if not educated, on this meaningful and futuristic process. We would also like to extend our gratitude to Dr. Walker and Dr. Catherine Morris, our inaugural executive directors, and Dr. ABC Rao, our academic advisor, for joining us with your presence this evening. We appreciate your endless support and thank you for playing a key role in supporting us throughout our journey thus far. We thank you all for taking your valuable time, effort, and consideration in the investment to nurture and properly establish the future of pathology. It is not only an act of success, but of greatness, showing us the paths that you have all walked. I would also like to recognize Dr. Kezu. Thank you for joining. Last but not least, ladies and gentlemen, I would like to thank you all for accompanying us tonight and making our event a success. And we look forward to your continued support. To all of our UE students and staff across 3 campuses at the University of Ottawa, and especially to our specially invited guests, thank you, thank you, thank you. Ladies and gentlemen, this marks the end of our session this evening. Thank you all for joining us, and we hope to see you at our future events. Good evening, all.
Make it last forever. Stop in time.